Hi, my name is Gloria Macias. My topic is Langerhans cell histiocytosis. Definition: Langerhans cell histiocytosis is a disorder in which the body produces too many dendritic cells. It is found mainly in the skin, bones, lungs, stomach, liver, and accumulated in various tissues and causes damage.
Langerhans cell histiocytosis, LCH. The histiocytic diseases in children and adults are caused by an abnormal accumulation of cells of the mononuclear phagocytic system. Only Langerhans cell histiocytosis, LCH, a myeloid-derived dendritic cell disorder, is discussed in detail in this summary. The histiocytic diseases have been reclassified into 5 categories, and LCH is in the L group. 1. LCH results from the clonal proliferation of immunophenotypically and functionally immature, morphologically rounded LCH cells along with eosinophils, macrophages, lymphocytes, and, occasionally, multinucleated giant cells. 2,3. The term LCH cells is used because there are clear morphologic, phenotypic, and gene expression differences between Langerhans cells of the epidermis, LCs, and those in LCH lesions, LCH cells, despite the pathology.
Application in nursing. The nursing intervention invaluable to the patient and perform the respective tests. Take care of the patient during the chemotherapy treatment. This implies the use powerful drugs to kill the cell or prevent them from growing. When the treatment of the histiocytosis of cell of Langerhans may see new lesion appear or all lesion repair, sometimes follow-up steps are needed.
Hi, my name is Dr. Ken McLean. I'm a pediatric hematologist-oncologist at Texas Children's Cancer Center in Houston, Texas, and I'm the clinical director of the histiocytosis program.
So hi, I'm Carl Allen. I'm also a hematologist-oncologist at Texas Children's Cancer Center. I'm the scientific director of the histiocytosis program, and I work with Ken McLean on histiocytic diseases in children.
Histiocyte is a white blood cell that's part of the immune system. It's supposed to pick up information and pass that information on to another cell of the immune system called the lymphocyte. And together, they make a response to an immunization, a germ, or a cancer cell. Histiocytosis is a general term for several diseases of these white blood cells called histiocytes. And the histiocytes have the ability to change their form and their function and look differently in these different diseases. But just as a general class, the histiocytoses are diseases where there are too many of these cells, along with some other cells, collected in some place in the body and causes the disease. The estimate is that there are between 5 to 8 per million children affected by Langerhans cell histiocytosis. That's the most frequent. The second most frequent is the hemophagocytic lymphohistiocytosis, or HLH, and the incidence there is between 1 and 2 per million. The histiocytic diseases are most frequently seen in children from birth to 6 years of age, but it can be at any age. The most frequent is Langerhans cell histiocytosis. The next is hemophagocytic lymphohistiocytosis, or HLH. There's juvenile xanthogranuloma.
Pros and cons. It a bit identifies that some children with low risk only affect the skin or bones. It will get better without therapy. If only one bone is affected, surgery is generally the first step used to confirm the diagnosis and eliminate the dendritic cell growth. Again, that affects more than one part of the body. The best treatment is chemotherapy, which lasts for 1 year. It requires stronger chemotherapy to cure the disease.
Hi, I'm Dr. Ken McLean. I'm the clinical director of the Histiocytosis Clinic at Texas Children's Hospital, along with Carl Allen, our director of research, and Olive.
Cell histiocytosis is the most common histiocytic disorder, and this has really been a disease that's been confusing the pediatric oncology and immunology community for the last 100 years or more. And one of the reasons is the different variety of presentations or the ways patients can come about to have LCH are hugely variable from a baby who might just have a single skin lesion that'll go away by itself to really life-threatening disease that can look a lot like acute leukemia and require very severe treatment. There's a cell called a Langerhans cell that we all have in our skin, and the job of this cell is to be the guard against all the germs in our environment. It tells the immune system certain germs it's supposed to fight or certain germs that it's not supposed to fight against. And because this cell in our skin looks very similar to the cell in LCH lesions, the assumption has been that LCH comes from this skin cell that sort of goes berserk for some reason. And what we've learned through our research is that, in fact, the Langerhans cell in the skin has been incorrectly blamed for causing Langerhans cell histiocytosis. And in fact, LCH arises from a different part of the immune system that looks a lot like the Langerhans cell. And the type of LCH that a patient has really depends where in the development of that type of cell this cell kind of gets bad instructions and starts behaving inappropriately. HLH
Issue applied in Ecuador. The Langerhans cell histiocytosis association determines a rare disease occurs 1 in every 200,000 people. It has been reported in various countries. In our country, it has not been reported, but studies are being carried out on Langerhans cell to identify the pathology and apply the respective treatment to avoid possible complications.
This is a case of Langerhans cell histiocytosis, or LCH, of the pituitary gland and infundibulum in a 6-year-old male. The first image is sagittal T1 weighted with some motion degradation. It demonstrates thickening of the infundibulum and pituitary gland itself with classic loss of the typically hyperintense posterior pituitary. The non-contrast coronal T1 correlate redemonstrates the infundibular thickening as well as enlargement of the pituitary gland itself. The third image with T2 weighting in the coronal plane redemonstrates the thickening of the pituitary stalk. The multiplanar post-contrast T1 weighted sequences demonstrate avid post-contrast enhancement of the markedly enlarged infundibulum and pituitary gland itself. LCH is a reactive clonal disease of monocyte macrophage system and may affect almost any organ system. LCH CNS involvement may fall into one of several forms such as osseous lesions with or without soft tissue components, intracranial extraaxial lesions such as in the hypothalamic pituitary region, meninges, or circumventricular organs, intracranial intraaxial lesions, and cerebral atrophy. LCH is the most common cause of infundibular.
Conclusion. Most cases occur in children between 1 and 15 years old. It is believed that this disorder affects 1 in 200,000 people a year. The abnormal increases in the Langerhans cell can for tumor and affect various areas of the body, generally affecting the bones, but also other parts. The symptoms vary in each patient.
My dear students, thank you for attending. Let's start by simulating the command function where Langerhans cells have the role of a liaison. Are you ready? This is the cross-section of skin. Okay. Now, let's observe. When foreign factors invades the skin, Langerhans cells sense it and move below the basement membrane to give the order to other immune cells to attack the matter. Let's move on to simulating the self-defense function where Langerhans cells assume the role of reliever. It's the skin cross-section again. Let's observe. When stimulated by the external environment, stimulation response factor appears inside the skin and causes problems on the skin. On sensing it, the calming enzyme CD39, covering Langerhans cells, attacks the factor directly to achieve self-defense.